Now look at another type of amputation, and this is what is known as a below the elbow amputation. So below the elbow, you're actually cutting through the radius bone. Like see, anything below the elbow, the most prominent bone there is the radius. Yeah, the ulna is there, but most of the times they refer to the radius. You understand? So of course, from this place to the wrist, any place you are cutting from the elbow down the elbow to the wrist, any region is transradial. You know. So it's a surgical removal of the forearm, and you do this through the radius and ulna below the elbow joint. It's actually one of the most common upper limb amputations, and people generally prefer this because I don't want my hand to be cut at this level. It will limit me more than if it is cut at this level. At least I can be able to use this thumb to be able to do some one or two activity. Do you understand? So that's it. So causes, what are the reasons why they might actually want to cut your hand at that level? Maybe you had a lot of trauma, like crushes, accidents, maybe there was war, you know, and you're affected. It could be cancers. So you have cancers from down spreading up, so you want to actually keep it out from going further. It could be infections like osteomyelitis or gangrene. It could be poor blood supply and has actually led to a lot of tissues dying. So sometimes congenital malformations, and they just need to cut the hand so that they can put a good prosthesis for you. So surgical procedure is the radius and ulna are cut at the appropriate level. So muscles and skins are shaped to create a functional residual limb. So nerves are carefully managed so that they reduce pain and prevent any neuronal formation. So the stump will now later on be closed in a way that allows for prosthetic fitting. Okay, so rehabilitation now, prosthetics is what they put there. So transradial prosthesis can be put there, you know, to just help you, you know, facilitate your activities there a bit. The physical therapy is where they try to strengthen the person. The person is learning how to use that hand all over again, you know. The occupational therapy, this is when they try to, you know, teach you on how to use that hand again to be able to do your daily activities. And also psychological support, where they are trying to advise you on how to cope with your limb loss and adapt to new life circumstances.